I want to give an update in regard to the central scheduling system known as VMS. We have talked in the past about Ohio's efforts to establish a centralized vaccine scheduling website for those Ohioans who would prefer to use that option when scheduling vaccination appointments. This system is a statewide portal where Ohioans will be able to go to confirm that they are in a certain group that is eligible, to make sure they're eligible. And also, though, they'll be able to find providers near them and schedule their vaccine appointment. In addition to increasing convenience for those already eligible, this system will be critically important as we look forward to a time when we receive more vaccine and more Ohioans become eligible. It is because it's scalable. This is a system that has been built to expand, and it will be of particular importance down the road when we have more and more vaccine coming into the state of Ohio. It will be imperative that we have this system available. Good news is that our first phase for launching the system has been completed, as our Department of Health team and our technology consultants have developed the site and have made it functional and ready from a technical standpoint. Early in vaccine planning, Ohio looked into the federal government's centralized scheduling solution they intended to develop for all states, because I know we've gotten questions about that, so I want to cover that. Our team, frankly, reviewed that system and decided, as did 40 other states, roughly 40 other states, that the system would not work for Ohio. Instead, Ohio chose to build our own system, our own solution. And despite the significant build time and configuration required for a software project like this, I'm happy to report today that this was done within our intended time frame, which was an aggressive goal for a huge IT project. Centralized scheduling websites such as this one work best when a large number of providers have added their appointment availability into the system. So this would be our community health clinics, this would be our hospitals, this would be our health departments, it would also be our pharmacy providers. We know that that is what people want, one place where they can go to book their appointment instead of calling around and visiting a number of websites. Therefore, the next phase of our launch of this site is an aggressive outreach that has already begun to vaccine providers to sign them up to participate in our central website. We have to have them signed up. And here's what we're doing to accomplish this goal. New COVID vaccine providers, ones that are just coming on, that have not been with us as we expand. New providers that begin to provide vaccines in Ohio, the new ones will be required to use the system as they come on. Second, we're conducting an aggressive outreach with current providers to encourage signing up just as soon as possible. Providers will be expected to use this system as we look to the future, and we will provide guidance in the near future regarding what those deadlines will be. Three, some providers have also informed us that they have extensive waiting lists. And our team is working directly with these providers to assist them in working through their wait lists and potentially integrate these commitments that they've already made, the wait lists that they already have, and putting that into our system without new patients jumping in line in front of them. This is one of the concerns that many of these providers had. They had the list, they had people in order, and they did not want to lose that ability to continue to go in line. Also, some providers have also told us that they have contracted with other companies or already have systems in place to help them. And it will take them some time to transition from those systems into the state portal. We encourage them to do it as quickly as they can. This is normal for an IT project such as this. So the Ohio Department of Health is committed to work with them to integrate into our system, their system, as quickly as possible. During the next 2 to 3 weeks, we will continue to work directly with these providers, pharmacies, health departments, et cetera, our local people who are delivering these vaccines every day. Our local health departments, our fairly qualified health centers, pharmacies, to help them transition to this new system. We expect these numbers to grow as these providers work through their wait lists. We'll provide extra service to help them get set up. We'll work with them one-on-one to make sure the system can work well for everyone. Once we have a critical mass of participating providers signed up, our third phase will be to make the site live to those seeking to be vaccinated. And we'll be very happy, and we hope everyone else will be happy when we reach that goal. Our goal is for Ohioans to have a positive customer experience when we launch to make these appointments. Those interested in getting a vaccination will be able to put their zip code in, pull up appointments within 20 miles of their location. We know further that not everyone has access to the internet, and we've called on our partners, including the area agencies on aging, to help Ohioans navigate appointment scheduling.